Fosaprepitant, also known as Emend Vial, is a medication used in combination with other drugs to prevent nausea and vomiting caused by chemotherapy. It works by blocking a naturally occurring substance in the body that triggers vomiting. It's important to note that this medication will not treat nausea or vomiting that has already started. Be sure to consult your doctor for advice on what to do if you are already experiencing nausea or vomiting. The recommended dosage and optimal timing for taking Emend Vial should be discussed with your healthcare provider to ensure the best results for your specific situation. Before you start using Emend Vial, make sure to read the patient information leaflet from your pharmacist. This medication is given by injection into a vein by a healthcare professional as directed by your doctor. The infusion of this medication is usually finished about 30 minutes before the start of chemotherapy. Your doctor may also direct you to take a form of this medication given by mouth, Fosaprepitant, for the next 2 days. Children's dosage is based on weight and age, so make sure to follow your doctor's instructions carefully. Fosaprepitant may rarely cause severe allergic reactions while it is being given, so it's important to tell your healthcare professional right away if you have any symptoms of a severe allergic reaction during your infusion. If the infusion is stopped, do not use Fosaprepitant again. Also, make sure to tell your doctor if you vomit or feel nauseated. If you experience tiredness or hiccups, make sure to inform your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because the benefit outweighs the risk of side effects. Most people using this medication do not experience serious side effects, but it's important to tell your doctor if you notice any redness, sores, pain, or swelling at or near the injection site. While a serious allergic reaction to this drug is rare, seek medical help immediately if you experience symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, make sure to contact your doctor or pharmacist. Before using Emend Vial, it's important to let your doctor know if you are allergic to Fosaprepitant or Aprepitant, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. Additionally, inform your doctor or pharmacist about your medical history, especially if you have liver disease. If you are planning to have surgery, make sure to disclose all the products you are currently using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Emend Vial should only be used when clearly needed. It's essential to discuss the risks and benefits with your doctor. It is also unclear whether this drug passes into breast milk, so consult your doctor before breastfeeding. Remember to follow your doctor's instructions carefully and take this medication at the recommended dosage and at the optimal timing for the best results. When taking Emend Vial, it's important to be aware of potential drug interactions that could affect how the medication works. Some medications may speed up or slow down the removal of Emend Vial from your body, which may impact its effectiveness. It's important to discuss all the products you use with your doctor and pharmacist, including prescription/non-prescription drugs and herbal products. For example, medications such as azole antifungals, diltiazem, macrolide antibiotics, HIV protease inhibitors, and certain anti-seizure medicines may affect the removal of Emend Vial from your body. Additionally, if you take warfarin, Emend Vial may affect how well warfarin works in your body, so your doctor should monitor your blood during the 2 weeks after your treatment. It's also important to note that Emend Vial may decrease the effectiveness of hormonal birth control methods, such as pills, patches, or rings, which could lead to pregnancy. Be sure to discuss with your doctor or pharmacist whether you should use additional reliable birth control methods while taking Emend Vial and for 1 month after stopping the medication. And if you experience any new spotting or breakthrough bleeding, it's important to inform your doctor, as these may be signs that your birth control is not working effectively. Lastly, it's important to avoid using Aprepitant while taking Emend Vial, as they are very similar medications. Be sure to follow your doctor's guidance and discuss any concerns you may have about potential drug interactions with Emend Vial. And as always, do not start, stop, or change the dosage of any medicines without your doctor's approval. If someone has taken too much Emend Vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to act quickly in these situations to ensure the person gets the necessary help. Emend Vial is used to prevent nausea and vomiting caused by chemotherapy. It is also used to prevent nausea and vomiting after surgery. This medication is given as an injection by a healthcare professional. The dosage and timing of the injection will depend on the specific chemotherapy regimen or surgery. It is important to follow your healthcare provider's instructions carefully for the best results. Emend Vial works by blocking the action of a certain natural substance in the body that causes nausea and vomiting. Make sure to take each dose of Emend Vial as directed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. This medication, Emend Vial, is not taken at home and is only administered in a clinic setting. It is not meant to be stored at home. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.